We'll start and welcome. My name is Gina Clonan. I'm the founding president of the Connecticut Women's Hall of Fame. For nearly 3 decades, the Hall has worked to discover and share the stories of women. Our various educational platforms acknowledge the individual and the collective feminine voice. There's no more important time than now to talk and listen. This will be a half-hour intimate and informative chat, followed by 15 minutes of your questions, which we encourage you to submit at any time during this webinar by simply clicking the Q&A bubble at the bottom of your screen. And be certain to expand your screen so that you can see that bubble. I'll try to get to as many as possible. Our goal is simple, a virtual gathering to talk about today's important issues. We hope this will be a useful source of information while offering up helpful takeaways. We're honored today to have as our guest an experienced advocacy professional, skilled in policy development, lobbying, volunteer management, public relations, and public speaking. She's committed to advocating for AARP's 600,000 members in Connecticut and helping everyone choose how to live as they age. Please welcome Anna Doroghazi. Thank you for being with us today, Anna.
Thank you so much, Gina. Thanks for that very generous introduction. I'm really excited to have a conversation on a topic that I think is really important and much more interesting than I think a lot of people give it credit for.
I couldn't agree with you more. And I'm going to start with a page out of your book for our listeners from your testimony in the State Senate chamber earlier this year. And I quote, AARP is a nonpartisan social mission organization that advocates for individuals age 50 and over. We have a membership of 38 million nationwide and nearly 600,000 in Connecticut. We advocate at the state and federal level for the issues that matter most to older adults and their families. And we support policies that help Connecticut residents age safely in their homes, care for their loved ones, and live with dignity. As a mutual nonprofit organization, Anna, share with us the history of AARP's founding, its initial purpose, and its present-day model.
Sure. So I love having the opportunity to talk about the history of AARP because there's such a wonderful background story to it that I don't think people realize. I don't think most of even our members realize that AARP was founded by a woman, Dr. Ethel Percy Andrus, who is a remarkable person. She was the first female school principal in the state of California. And she was, after she retired from that position, she was a member of the California Retired Teachers Association. And in that role, she received a call from someone who said, I think there's a retired teacher who lives in my neighborhood. She seems to be in rough shape. She could use, just somebody to check in on her. So Ethel, Dr. Andrus went to visit this woman and found that she was living in a chicken coop in somebody's backyard. This was a woman who had worked her entire life as a teacher, had a small pension, made some investments during the Great Depression and ended up losing a lot of money, but was then living, in a chicken coop in poor health, didn't have enough to eat. And Dr. Andrus's response to this was to get angry and to say, this cannot be how we treat our educators in their retirement, and then to get organized. So in 1947, she founded an organization called the National Retired Teachers Association. And her primary goal in doing that was to try to find health insurance for retired teachers. She identified this gap, with this woman that she met. And she approached 42 separate insurance companies trying to get someone to provide coverage for these teachers over the age of 65, and was turned down 42 times. Finally, found someone willing to work with her, and then, built this National Retired Teachers Organization until 1958, when at the age of 74, she founded AARP as an organization to represent the interests of all older Americans.
What year was that again?
Sorry?
What year was that again? AARP was founded?
1958. Yeah. So it's just, it's this incredible story of just her passion and her grit. And it's also a really great aging story. She's in her 60s and 70s as she's doing this work. and founding what's going to come to be one of the largest membership organizations in the country. So just really, really amazing woman.
And I should mention, as a state Hall of Fame, that she was inducted into the National Women's Hall of Fame, and she is also a Women's History Month honoree. Certainly an incredible example of what women can do at every stage of their life. So let's move on with the organization's mission and vision, and how much has it changed or kept in line with what she had hoped for?
Yeah, I think, we tried to remain really true to some of those founding principles that Dr. Andrus brought to the table. Our mission is to empower people to choose how they live as they age, which I think really nicely ties back to that story of the chicken coop, that there was nothing empowering to be that woman who didn't have adequate access to healthcare, who didn't have adequate finances to support her in her retirement. And so much of how we orient our legislative agenda and the work that we do as an organization is around making sure that people have real choices. And we stick by that every day, and we try to make sure that, when we're out in the community, that's what we're always bringing to the forefront in our work.
That's incredible. I might mention that AARP was named by Fortune magazine as one of the most powerful political organizations in America, with, as we mentioned, 38 million members, just shy of 40% of Americans 50 plus, and $2 billion in annual revenue. What are the challenges to being nonpartisan in this divided political landscape?
Yeah, so the challenge is that I think a lot of people have come to want every issue to belong to one political ideology or another. I think, we're in just an incredibly divided and partisan moment, and people try to see divisions, I think, sometimes where they don't exist. But that said, the advocacy issues that we take on and the issues that really matter to the 50 plus are important regardless of political affiliation. So older adults, they want to protect Social Security. They want to protect and expand Medicare. They want to be able to pay their bills and pay for prescription drugs. People think it's important that we support family caregivers. So there's so many issues. I sometimes wonder, are we sort of the final frontier of bipartisanship, with the issues that we work on? But,
I like to hear that. As a boomer myself, it's nice to hear that we can agree on a whole lot of stuff in terms of the aging process and the dignity and quality of life after 50. So I love that. And I'd like to ask you, and I know it's a tough question, but if you had to name the number one issue people face as they age, could you?
So I think I'm going to cheat a little bit in responding to this question, because I think, this is kind of an umbrella issue. And I think it just comes back to what we were discussing earlier, which is choice. People want to have choices as they age. They worry that age discrimination will limit the choices they have when it comes to a fulfilling career, and they worry that their finances will limit the choices that they have when it comes to when they can retire and how they can live when they retire and where they can live. They worry about having real choices when it comes to who's going to provide care for me if I need it, and where can I receive that care. And I think, there are some limits that are part of the natural aging process. We can't always choose what happens with our bodies or our relationships, or, people that we love die, and that's, part of life. But we do have a lot to say in how well we design our society and our systems in a way that can impact those choices. So have we, do we have a built environment around us that gives people choices as they age? If you can't use stairs or their ramps. So, that I think choice is maybe a cheating way to respond to that, but it really is
I think actually it was a very clever and all-encompassing response to my question. I wish I had thought of that. The Older Americans Act, created in 1965 as part of Lyndon Johnson's Great Society reforms, was groundbreaking, creating many programs and resource centers for aging Americans. Some still exist, some don't. Can you bring us forward on a national level to what you see as some of our rights and protections?
Sure. So 1965 was a really big year for older adults. So in addition to the Older Americans Act, that was also the year that Medicare was created. AARP, played a role in advocating for that. And the Older Americans Act, OAA, to this day is still one of the main vehicles for providing social services and nutritional services to older adults. That's the vehicle through which we get state offices on aging and area agencies on aging and funding for senior centers. And I think there's still a lot of work to be done in terms of making sure that we're adequately as we age protected and that we have access to what we need. But the OAA does some really wonderful things. Just one sort of quick example, state long-term care ombudsman programs, which are sort of the guard dog agency for people who receive care in nursing homes and other facility-based long-term care settings. The state long-term care ombudsman here in Connecticut was absolutely critical during the pandemic when it came to protecting the rights of nursing home residents, communicating to families. So I think, that Older Americans Act, the legacy of that goes into so many places and in so many different ways, bolsters the rights of older adults.
I couldn't agree more. And I just think most of us notice, elder care services, the terms didn't even exist, but they're everywhere. And if any one of us have cared for a loved one, as I am doing at the moment, you know that there are great organizations out there. They may be hard to uncover. You have to do a lot of legwork. And if you don't have access to the internet, I think that is, that digital divide is as great in young people as it is in older people, but there are so many available services to us. I think Dr. Andrus would be very surprised and very happy. Anna, U.S. News had a great report sometime back titled Aging in America, Land of the Free, Home of the Gray. I love that. Can you talk a little bit about what lawmakers are doing to stay ahead of the curve, or have we already fallen behind?
Yeah, so I think, there's some really important areas where there's a disconnect, from a policy perspective between the safety net that we have and the safety net that we need. So a lot of programs that we have, were designed for a time when food was the biggest single household expenditure for most American families. And households didn't spend as much money on healthcare and on transportation, and there weren't as many concerns, as we live longer, about caregiving. We were kind of at peak nuclear family when a lot of these programs came into place, and women were relegated to roles in the home. And it was just expected that, women are going to handle this. They're going to take care of it for us. We don't need, systems to do that. And I think we're starting to see some of those assumptions fray. And I do think lawmakers have noticed this and are starting to take steps toward addressing these issues. But I think, in particular, when it comes to the area of our caregiving infrastructure and our long-term services and supports, I think we have a lot of work to do. I think we're right at, at a really crucial moment and at risk of falling behind there.
And I appreciate us moving on to that subject, because for many women, aging places additional burdens and compounds experiences of gender inequality and age-based discrimination, of which you're referring. The feminization of aging reflects the fact that women already outnumber men in older age groups, and this disproportionately increases the older they get. And let's not forget that we're on the front lines of caregiving, whether it's in the medical fields, the community, or in our homes. Unfortunately, we don't have the time to address these issues on a global scale, but you and I recognize that women all over the world are carrying the load, often at a greater scale than we. So where do we begin talking about those burdens? I mean, we're mentioning caregiving, but we're also sandwiched in between children and grandchildren and parents. And do you see this as something that's going to roll out just on a state level, like many programs we need do, or do you have faith in maybe the new administration's social network platform that will, protect all of us across the board and help us with some of these burdens?
Yeah, I think, I've been encouraged in the last year. I feel like even some of our rhetoric and our observations related to caregiving in particular have changed. I think, it, gosh, you gave me a lot to work with there. I'm trying to parse out.
Sorry,
Oh,
yeah.
no, that's great. But what to address first? I think, in some ways, I feel really hopeful that we've noticed that caregiving is an important thing, that there's a lot of recognition that that we've just counted on women to do this for free. And I think the fact that we are starting to refer to it as work, both when it comes to childcare, when it comes to elder care, that's important because that is really key to how we value it. If we don't call it work, if we just say like, you're a girl, you'll do it, then, we see so many, disparities when it comes to how we pay childcare workers, how we pay people who provide, paid caregiving services. So in the US, almost 2/3 of our family caregivers are women. And if you look at that paid caregiving workforce, it's almost 90%. And almost half of that 90% are women of color.
Mhm.
So I think we need to really take the time to look at that workforce. We need to look at the informal aspects of that workforce and make sure that it's equitable. We're seeing some conversations about this right now federally. One of the proposals that's on the table that the president has supported is around a caregiver tax credit. We know that family caregivers pay a lot of money out of pocket, upwards of $7,000 a year on average to care for their loved ones. So yeah, there's a lot of work to do there and a lot of work that falls to women.
Yeah, and is along with AARP, I know that, nonprofits like yours and ours often take up the load for what's happening in our community. And they're oftentimes ahead of the curve with less bureaucracy. Can you talk a little bit about what citizens, employers, and retailers are doing on their own? I mean, I just have to mention that, when the pandemic started and I got to go to Trader Joe's before anyone else in the morning, I was really happy. So I thought, well, this is a nice perk of getting older.
Yeah, and I think, I've heard it referred to as the silver economy, that people have said, wow, there's a lot of opportunity here when it comes to, what kind of housing do older adults want? Do they, there was so much emphasis for such a long time on, single family homes with large yards, but not everybody wants that anymore. People, there's been a shift toward people wanting to feel more a part of a community and to have more walkable communities, to have better access to transportation. So I think, in the private sector, as well as the nonprofit sector, I think people are looking at that and saying, okay, we're going to have a lot of older adults, than we ever have historically. And their needs are really different and their desires are different than they were a generation ago. And they have tremendous spending power. In Connecticut, people over the age of 50 are about, I think, 37% of the state population, but they represent 58% of consumer spending in the state. So I think, for better or worse, I think you have people saying, ooh, like maybe we can profit off of this somehow, which, can bring about more and better options and choices and help people access what they want. But I think there are also, risks and dangers to that. We have to make sure that people aren't, exploited just because they're, a potential booming market for business.
That's right, which is great. And you hear a lot of public service announcements right now about that kind of exploitation, helping people to recognize, particularly online or through our telephone systems, what's going on out there, that we are a target for a lot of exploitation. I know I wanted to mention too, because you were talking about lifestyles for the elderly are evolving. And of course, age in place is a significant issue that I presume I didn't look into this myself, but I presume that AARP has a position on that, is in promoting those dynamics of age in place, because most people would love to stay at home if at all possible. And even if they're staying at home with family, would like to be less of a burden and less of a safety risk in those environments. So age in place policies are something we could all readily embrace. Would you agree?
I absolutely agree. And I think, I sometimes think about policy and, legislative work as this invisible hand that kind of guides us, whether we see it or not. And I think, in the last 20 years or so, there's been a really big shift, and again, this is like a very invisible hand with, state Medicaid policy, but it used to be that, Medicaid would pay for you if you received care in a nursing home, like in an institutional setting. And as a result, that was where a lot of people ended up receiving care. But now, as Medicaid coverage has changed and is covering more home and community-based services, we've seen just a tremendous shift in the last 20 years or so of people coming out of that facility-based care and staying at home. So I think, policies have better kind of clicked into what is it that people want to see? Where do they want to live? How can we support that? And I think, there's still a lot of work to do. We still have, some gaps when it comes to the workforce that's providing that care in the community. But yeah, I think, there are a lot of opportunities and a lot of challenges, and, businesses and government and nonprofits have all said, oh, wait, people do want to stay in their communities. It's cheaper to provide care there. Little tweaks to policies can make that more possible for people.
So let's encourage our listeners to, Google age in place. There are so many simple steps you can take to make your own home or the home or business of a loved one much easier to reside in. I want to go back a little bit because I don't want to miss the opportunity to talk about the larger burden on women of color in our society, not only due to social injustice, but particularly in terms of caregiving. And then in terms of aging, can you create a little picture for us that what their burdens would look like compared to other members in society? Or is it evening out? Or what can you tell us about the burdens on women of color?
Yeah, I think a lot of the disparities that we see when it comes to, women and also men of color comes down to fundamental economic disparities. So when there was some really great research that came out that's Connecticut specific over the summer called the Connecticut Healthy Aging Data Report that really did a deep dive into what are different health outcomes in towns across Connecticut. And what we saw was that towns that have, typically whiter populations that are more affluent have much better health outcomes just across the board. Even with things as basic as, they're more likely to get their flu shot every year. They're less likely to experience depression. They're more likely to, have regular access to healthcare services. So I think, as long as we have these underlying economic disparities between men and women, between women of color and white women, I think all of that, it just creates a situation where you see worse outcomes across the board. So until we can really dig in and, figure out how do we create economic equality, we're going to see suboptimal outcomes for, women and women of color in particular, when it comes to all sorts of facets of aging.
And someone was telling me the other day that, healthcare all over the country, of course, is changing and it is in desperate need of fixing. But for instance, in Connecticut, we have large groups taking over. I think there's just 3. I can only remember 2, Yale, New Haven, and Hartford Health. Taking over the state's, distribution of healthcare. I wonder, because you're on the Hill and you're talking to people, do you think that's going to present better opportunities for a more equal distribution of healthcare services, or is that going to be worse?
I think I think there are a lot of negative implications to that. And that's an interesting one, because I think where we've seen new disparities emerging in that, very particular issue that you've raised is when it comes to rural access to healthcare services. So I think, I've seen research that says, as you see a lot of like hospital and health network consolidations, you see the closing of these more local clinics, and people have to go further for services. And again, this is where if you are experiencing any form of economic disadvantage, well, now you have a transportation issue, and that transportation issue turns into a healthcare issue, and that healthcare and it just keeps, whatever you think about, trickle down economics, like we have like trickle down disaster almost, where one link in the chain breaks, and so much else follows.
And again, Anna, it illuminates the importance of the issue of choice, how we started this conversation, because it may very well be that with this kind of consolidation, people have less choice, particularly people, as you say, in areas that they depended on something more local for a myriad of reasons, cost, transportation, all of that. I have to ask you, when we talk about all these different issues facing aging, is it when we see such changes in generations, particularly in the home, with men and women your age sharing more of the duties, sharing more childcare, I wonder if that also translates to sharing more elder care, all of that. Do you see within your generation and those younger a different approach to aging in America? And has the efforts of AARP and other organizations highlighted the importance of it, or are people still inclined to be so youth focused and not want to sort of face, even if it's their own future, the inevitable?
Yeah, I think sometimes I'm evenly split on these issues. So there's part of me that's really hopeful, that sees the promise of, being several generations in now of, more feminist thinking, and how has that changed, women's earning potential, and our role in the workplace, and our role in the home, and more equitable distribution of how we, care for each other in society. So that's the hopeful piece, that like, maybe it's working. Maybe we're all going to, be more invested in providing care for each other as we age. But then, we have hard data now about the pandemic, and, it was women who were leaving their jobs to come back to the homes, to take care of children, to take care of elderly loved ones. So I think I need to be hopeful that we're going to see, continued change and, greater shared responsibility when it comes to caring for an aging population. But then, I look at the numbers from the pandemic and I think, like maybe we're not exactly where I would have hoped that we were.
I couldn't agree with you more. We're coming toward the end of our discussion, and I have a few more questions for Anna before we open it up to you, all of those online with us today. So please be sure to pop something in the Q&A bubble or the chat, and we'll get to them in a few minutes. So let's close this discussion with Connecticut's problems and promise. And we've outlined some of the problems nationwide. Are there some that are specific to Connecticut, or more important here than in other places? Or how would you look at Connecticut's progress?
Yeah, so I think, a couple of the challenges that we see in Connecticut is that we're among the more expensive states, especially when it comes to some of our fixed costs, like housing, utilities. So those are issues that, we try to be very attentive to at AARP. What are we doing to make sure that utility costs don't go through the roof when we know that, a lot of AARP members are on a fixed income? I think the income disparity piece is also a really important issue in Connecticut. And I think, we're the seventh oldest state in the country. We're about, as a nation, we're like 13 years away from an anticipated change where we're going to have more older adults than children for the first time in US history.
How many years did you say?
So 2034, I think, is when the Census Bureau thinks that shift's going to happen. And, for an older state like Connecticut, I think it's really important that we build ourselves a long runway to say who is going to participate in our care economy. Are we going to continue to rely largely on unpaid family caregivers? If so, how are we going to support them? And if we want to build a paid workforce, how do we create thousands of new jobs that aren't poverty wage jobs? So I think, that's the moment that we find ourselves in Connecticut. And I think it's a mix of challenge and opportunity. We could be thoughtful, we could be inventive, we could be creative and do this really well, or we can just hope for the best and not have as good of an outcome.
And do you find, as it has been with other kind of big social movements facing the nation and states looking at them individually as well as together nationally, do you think Connecticut could be on the forefront of change and sort of be a bellwether state where the issues of aging in America are talked about?
I think so, and I think we've seen again, in a pretty good bipartisan way. We just in the last legislative session passed an age discrimination bill that went into effect October 1st. That is going to now it does prohibit employers from asking for your high school and college graduation dates as part of the application process. You couldn't ask people their age, but you could say, oh, well, when did you go to high school? And with just a little bit of math, but that had, bipartisan sponsorship. And I think, not every state has that. So we were able to be a bit of a leader there. We saw some really important nursing home reforms during the last legislative session. That's all right.
I apologize for that. I don't know what happened there. I tried to turn that off. We talked about that.
That's okay.
I apologize.
No, that's fine. But yeah, I think one of we're lucky that these issues have enjoyed bipartisan support here in Connecticut. And I think, I'd be remiss to not mention, one area where we're national leaders with our paid family and medical leave program. The benefits for which, go into effect January 1st of 2022. We have the strongest paid family leave program in the nation that, specifically takes into account family caregivers, with a broad definition of family. So it's not just, your blood relatives, but who is your chosen family? So I think we are a national leader on some of these issues. And I would love if we could continue in that spirit moving forward.
That is so good to hear. And again, reasons for us to love the state we live in, right? Anna, you're no stranger to women's issues. As former policy director for the Connecticut Sexual Assault Crisis Services, also known here at home as CONSACS, you're clearly not a member of AARP. So in closing, what inspires you for your field work and motivates you to fight for the quality of life issues facing aging Americans? I'm intrigued by your presence in this process.
Yeah, so I think for me, what motivates me is hearing from people, hearing their stories and understanding that the choices that policymakers make impact so much of how people, literally how they wake up in the morning and proceed through their day. And it's amazing to me that we have the potential to do better. We have the potential to make things worse. So I love being engaged in that. And I'm so inspired, in large part by, we have, more than 140 AARP volunteers who, have been so generous in sharing their experiences and their insights with me. And I love learning from them and working with them. The bottom line too is that I'm aging. Everybody is. It's one of the few very universal issues is that every minute of every day we're aging right from right from go. So it's an issue that's interesting and that has a lot of impact, and I really love working on it.
Well, I'm so glad you do. And we're going to open it up to questions in just a moment, but I'm also going to remind our participants today that we have a little short poll. It's just 3 questions. So I'm going to launch it and it'll appear on your screen. And I hope you will all participate in the poll. It should be at the bottom and you'll see a queue for that. I'm going to open it up to some questions and we've got a few chats. Okay, so let's start here, Anna. I'm wondering what services available to women between the ages of 50 and 65 years. It's a transition that we still feel young, but menopause reminds us of what's coming. So that's a very good question.
Yeah, so kind of back to what we were talking about with the Older Americans Act and some of the more formalized services and systems. A lot of those don't start until age 60 or 62 or 65 seem to be sort of the 3 ages where there are certain benefits and programs that attach. AARP membership begins at age 50, in large part because we recognize that people in that 50 to 65 age group are starting to see, their healthcare starting to get more expensive. They might not, they're starting to experience age discrimination. So they're starting to see some of those, negative societal, issues and pressures related to aging, but they didn't really have anybody in that space to help them. So, AARP tries to take on issues that will benefit that 50 to 65 age group, in part because there is a gap there, especially when it comes to community services.
Exactly. Here's Lynn Barker Steinmeier asking everyone, I live in Litchfield County and I have to take days off from work to take my mother to Hartford Hospital for procedures and appointments. She's speaking, there's no question, but she's certainly speaking to the difficulty that you talk not only about caregivers, but about people in rural areas in Connecticut getting the resources they need.
Yeah. Yeah, and I think I would mention with these sort of intermittent caregiving duties. Again, one of the nice things about the paid family and medical leave program, and maybe this speaks to Isabel's comment as well about services for folks 50 to 65. For folks who are in the workforce, that paid family and medical leave program, I think, is going to have a real impact. So much of the conversation about paid leave focuses on maternity and paternity leave and those kind of early childcare situations. But the potential for older workers and for people who have those caregiving roles, I think, is really important.
I agree. Let's see. Someone else, that's another chat about all the issues that women have to take time off from work often to address things. So here's a question. Helen, thank you for this great presentation. Is there a starting point or a central location you recommend to access resources on various topics, such as downsizing residence for elders, affordable home healthcare options, et cetera, et cetera?
Yeah, so two resources right off the top of my head. AARP, if you Google AARP livable communities, we have just a wealth of policy information, but also practical information about how to think about options for living in place or for aging in place. We have something called the Home Fit Guide that talks folks through considerations about, what are small tweaks that I can make to my home environment that are going to make it a little easier for me to age safely and independently at home. So that livable communities section of our website just has so much good stuff there and things to think about. We have a tool that ranks communities on different metrics like affordability, transportation options. So that's a good starting place. And then affordable home care options. I would recommend My Place CT. That is the state of Connecticut operates it. It's something that's called a no wrong door approach. So that website has a listing of a lot of the different programs and services and benefits that can help people stay at home. So that's a good, just in terms of that immediate, like, how do I orient myself to all the programs and services? My Place CT is a good starting point.
I'm going to remind everyone that that was a plethora of resources, and we'll be sure to post those on our website. All of our webinars are recorded, and they will be available within a few days for you to share with others, or for those who are unable to make it to see them. And they remain there as one of our great new educational programs that we're very proud of. Anna, you've been a great guest. Is there anything that you had in your mind that you wanted to tell us today about aging in America that perhaps we didn't get a chance to talk about?
We covered so much ground. It was really fun to talk about. One thing that I would mention, because I always like to mention it, is just to remind folks of the power that they have when it comes to being advocates in the community. I know it doesn't always feel like we have a lot of ability to sway public discourse from time to time, but I always love to remind people that, our lawmakers work for us, and that we do have voices, and our experiences and our stories are worth sharing, and everybody should feel empowered to get involved in that way.
Well, thank you. And the Connecticut Women's Hall of Fame is about stories and empowerment. So that's a wonderful way to end. I want to thank you again, Anna, for joining me. This has been so enlightening, and you're a terrific guest. And I'd also like to thank the William and Alice Mortensen Foundation and Avid Grid Foundation in partnership with CNG, SCG, and UI for supporting this series. I hope you all will join me coming up on November 4th for the Connecticut Women's Hall of Fame virtual event, which is a ride through our open air event that took place in September. And I'm going to have an opportunity to talk with our 2021 inductees, Teresa Younga and Kika Matos, on the issues of social justice. I hope you'll join us virtually online November 4th. And later in November, I'm going to talk with Times author and renowned speaker Janice Kaplan on the idea of gratitude and how good it is for us mentally, physically, and spiritually. And that'll be coming up right before Thanksgiving. So thank you all for joining us today. Thank you again, Anna. Have a great day, and we'll see you all soon.
Thank you.